Hello, my name is Matthew Jones, and I am a nurse practitioner student. And previously, we did your health history, and now I want to examine your head, your eyes, your ears, your nose, and your throat. Are you okay with that?
Yes.
Great. It's going to involve me looking at your head, feeling your neck, looking in your eyes, looking in your ears, having you do some movements with your eyes, your head, your neck. Are you okay with that?
Yes.
And it should take no more than about 10 minutes at the most.
Okay.
Okay. So first we're going to start off with examining your head. And as I'm looking at her head, I'm looking and seeing that it is evenly shaped. It's round. I'm going to look at her hair. Her hair, she has dreadlocks. I'm looking at her scalp. I'm spreading her scalp to see different parts of it. Her scalp is not flaky. Her scalp is not dry. It's not oily. It looks to be in very good condition. As I look, I'm going to feel her scalp, feeling if I feel any lumps. Is there any tenderness?
No.
No tenderness. I feel your occipital bone back here. That's good. Let's see. She's brown skinned African American female. Looking at her ears, I do see that she has earrings in the earlobes. Don't see any pigmentation. Don't see any skin spots. Let's look at her hair. I don't find any nicks, any bugs in her hair at all. Keep on going. Let's look at your fingernails. She has artificial nails on, so I'm not able to check her capillary refill. But looking at her cuticles, there is no injuries to her cuticles. They are all intact. Let's see. She has maybe about 1/4 of an inch of free edge on her fingernails. Let's see. Let's check this. Flip your hand over. Oh, I do notice that she has a tattoo on the back side of her right hand, approximately 1 inch in length. It says Virgo. I'm going to pull your skin a little bit just to check your skin turgor. And her skin turgor is great. It is not tinting, so that's a good sign that she is not dehydrated. Now we're going to go ahead and move to your head and neck. As I look at her head, head is symmetrical, no facial drooping, her eyes are symmetrical. I'm going to feel on her neck to feel for any lumps or masses. Underneath her chin, there are none. I'm going to put your head here back a little bit right there, just so I can feel your neck. I'm going to start looking at the symmetry of her neck. Her neck is symmetrical. I'm going to start palpating to see if I feel lymph nodes. Let's see. Looking at her pre-auricular lymph nodes, I don't feel any. Then I'm going to look at the posterior auricular lymph nodes. I'm going to feel for occipital lymph nodes. I don't feel any. If I did, they would be P-shaped. They should be round and movable. Let's see. Let's feel her sternocleidomastoid. I don't feel any palpable lymph nodes there. Let's feel her submandibular. Then her submental. Then we'll feel her anterior deep clavicular. And then her posterior clavicular, and then her superior clavicular. I don't feel any there. I'm going to take my stethoscope, the bell of my stethoscope, and listen for any bruits at her carotid arteries. I don't hear any bruits. Okay. I'm going to palpate her sinuses, maxillaries, and mandibular sinus. sinuses. Any pressure there? Any pain?
No.
Good. Okay. I'm also going to check her thyroid. I'm going to come to the back to palpate her thyroid. Feels even on both sides. I'm going to have you swallow for me. I feel her hyoid bone push up and out. Do it again for me. Great. Now I'm going to check your temporal mandibular joint, which we consider, a lot of people call the TMJ. Open and close your mouth for me. One more time. Okay, no crepitus is noted there. Let's see. Okay, so let's check your eyes. If I had a Snellen chart, I should have put that up. I would have you, well, I can put that up. Let's see. Oh, I don't have a Snellen chart, unfortunately. Do this for me. I want you to cover your left eye. I'm going to cover my right. Now, I want you to tell me when you can start seeing my hand.
Now.
Now? Good. Take that down and cover your other eye. I want you to tell me, when can you start to see my hand?
No.
Good. I just checked your confirmation. Looking at her eyes, her eyebrows are even. Hair is evenly distributed. Her eyelashes are evenly distributed. I don't notice any ptosis or nystagmus with her eyes. Looking at her conjunctiva is nice and pink. Her sclera is white. No yellowing noted. Yellowing would be a sign of jaundice. Let's see. I'm going to turn the light off real quick, and I'm going to check your pupils, okay? So what I'm going to do is I'm going to check for her pupils to be reactive to light. I want you to just look at my nose real quick, okay? I'm going to look at the other one. Her pupils are equal, and they are reactive to light accommodation, meaning when light is shined into them, your pupils constrict, and when the light goes away, they open up, they dilate. They were about, let's look at them again real quick and see. Just to check and see where they were. All right. They're reactive in light as well. That's great. Let's look at, we're going to look inside your eyes now, okay? So I'm going to take my ophthalmoscope and I'm going to look into your right eye with my right eye, okay? Now I want you just to look straight ahead. And as I go in, I am able to see inside her eye. I'm able to see veins and arteries. The vein is bigger, the artery is smaller. I look further in the back, I'm able to see the macula. I'm able to see the optic disc, the arteries are pulsating. Didn't see any cotton wool spots. I'm going to look into the other eye. And at the same time, when I'm looking to your left eye, I'm going to use my left eye, okay? Once again, look straight. Looking in there. Let's see. Okay, I see it again. I see arteries, pulsating veins are bigger. Looking towards the back of the eye, I see the macula and then the optic disc. Very good. So also, I'm going to check your nerves that innervate your eyes, okay? So I want you to follow my finger, okay? I want you to, when I move my fingers, I want you to follow them. She's able to follow them. Down. Good. One more time. And then this time I'm going to do it over this way. That's good. Up. Very good. Okay, that's great. Now, I'm going to look into your ears. So I'm going to take my otoscope, turn it on. I'm going to put it in, have the handle up. I'm going to look inside her ear canal. I do see the tympanic membrane. It's nice and pink. No cerumen noted. I'm going to look over here. Do the same thing. Look in her inner ear. See the tympanic membrane. It's nice and pink. I'm going to also look inside your nose real quick. Get another speculum. Let's take a quick look in your nose. Up. Nice and pink on the inside. I do see some nasal hair. No mucus accumulation. Can you open your mouth for me real quick? All right. All of our teeth. Could you stick your tongue out and say ah? Ah, great. Well, I think I've looked at everything. I don't see any missing teeth. I don't see any caries, meaning any cavities. She looks very well groomed, very well maintained. I think that's all. Thank you.
Thank you.